Morpheus8 is the most Googled energy-based device in the world, and for good reason. It's got a long history of being a well-established, clinically proven RF microneedling system. What does this mean? Well, let me show you. So there are lots of settings and various heads and whatever, but I've got this set up, this platform, which offers Morpheus8 and some other technologies. This is a typical tip that we would use on the face. So it's got 24 pins housed inside this, and these pins are actually made of gold. And if I set it up, so it's 24 pin, and let's just increase the depth, just so you can see the pins come out a bit more. So I can program how deep I want these pins to go. We can then set the energy. At the moment it doesn't matter because we're not actually doing it on anyone. And this doesn't really matter unless you're a practitioner and you need to know how to use the device. If I then fire it up, it's ready to go. And if I press the pedal with my hand, you can see that the pins come out. 1, 2, 3. And you can see that they momentarily come out. And when they go to their program depth, which in this case is 4 millimeters, which I wouldn't really generally be doing on the face, of course, the RF, the radio frequency energy, just think of it like a form of electrical energy, but a little bit different to what comes out of the wall when you're plugging in a device. Whereas that type of electricity can go very deep and cause severe burns. With this form of electrical energy, RF energy, obviously through properly made and engineered devices, what we're doing is getting this electrical energy to hit the skin, and then it starts meeting resistance. And so it then spreads because it can't go too deep. And that's the safe bit about this stuff. And this is bipolar radio frequency, so it's designed to be quite superficial. And as it spreads, it produces this heating effect on the tissues. And that's one of the key things that radio frequency is aiming to do. And we know that when we hit certain target temperatures in the skin, we can trigger some quite powerful cascades of regeneration repair, stimulating proteins such as collagen, elastin, producing your own hyaluronic acid, and so on, improving that structural network of proteins that gives you that support and structure in the skin, making it firmer, plumper, tighter, etc. Now, there is a little bit more detail that I want to share with you because it is quite amazing. Now, these pins, when they come out, each of those 24 pins, imagine this is a pin coming out of the housing into your skin. It releases this radio frequency and it's actually creating 3 different zones of activity. So it's not just heat, and there are many machines out there that will give you a little bit of heat, great. What this is doing is immediately around the pinhead, it is creating a zone of what we call ablation. Now, ablation is what you see in resurfacing lasers, for example, such as CO2 laser or our amazing ultra clear laser. That is what we're getting, ablation. You're effectively getting rid of that tissue. That then can create a very powerful remodeling effect. Beyond that, we're getting this zone of coagulation. Now, coagulation is essentially like, you know, when you get an egg, you crack an egg in the pan and it goes white. That's the proteins in the egg coagulating. When you have a deep chemical peel, for example, a TCA peel, you'll see this frosting effect on the skin. That's coagulation, and then you get that nice remodeling of the skin. Well, that's what's happening here. And then if that's not enough, you get this bulk heating. Now, the electrodes, without trying to get too geeky and complicated, with a lot of these competitor devices, and I'm not saying that every other competitor device is rubbish at all, but why I think this is a superior device, or one of the reasons, is that where with a lot of devices, the pins, when they come out, are passing current from one pin tip to the other, which means 50% of the pins. So in this case, with another device, 12 of the pins would be positive electrode and the other 12 would be negative electrodes. And the current is passing between the positives and the negatives, giving you this nice heating effect. Great. But with this, you've actually got one side of the electrodes as the tips of the pins, and then the other electrode is in the actual main plate at the top, which you can see here. So when the pin's firing out, the current is going between each of the 24 pin tips back to the plate here, which means you're getting twice as much flow of current, and it's going all the way up to the skin surface, because this plate is going to be sitting on the skin surface, which means that that heating effect is now giving you what we call bulk heating, which means the whole depth of the tissues are getting that heat effect, because you want multi-layered improvement in the skin. And so really with this, you are getting, I think, more uniform bulk heating. You're getting this zone of coagulation, this zone of ablation. to really get maximal remodeling of the skin. But that is also why that with this device and with every other device that's of a similar nature, and probably any other energy-based device, who does it really does matter. Harm can happen from lots of treatments, and you can cause harm from this, you can cause harm from pretty much anything in this clinic. But we consistently see incredible transformational results with treatments like Morpheus8 because the technology is of the highest quality from the pioneers of modern radiofrequency devices in mode, and there is a safety backing behind it, validated safety and efficacy. And then it's how it's used. Often people do go too deep in areas they shouldn't do, so understanding the anatomy is very important. So as a patient, what do you need to know about this if you're thinking about having it? Well, firstly, do I need it? Well, if you're looking for any skin tightening, something a lot of people complain of is laxity around the lower face, sagging jawline, jowls, laxity in the neck. Very common. Men particularly complain about laxity around the eyes. Now, these are all perfect areas to treat with Morpheus8. The key thing then is who is doing your treatment, because how deep do they need to go to give you the benefits you want with skin tightening, and maybe you do want to reduce fat, because I haven't even mentioned the other benefit of Morpheus8, which is not just about the skin, but you can go deeper if you want to, and you can actually use that heat and that RF energy to contract what we call the fibroseptal network, FSN. Now, this is like the mortar within bricks of a brick wall, and it holds it all together. And when you contract the fibroseptal network, you actually contract the fat down. I've seen videos of a lump of fat on an operating table removed from a patient who was having liposuction, and then Morpheus8 being applied to that lump of fat, and you can see the fat contract in front of your eyes. So it really isn't removing fat so much. There's probably a little bit of liquefaction, but the main thing is that we're contracting it down but still preserving it, which I think is great. So you can do that if you want to, which is really good, because a lot of us, even me, and I say even me because no one will, I think, hopefully say you've got a fat neck, but some of this will be a little bit of fat expansion, which happens over time in this area. Whereas here we tend to lose fat, we want to preserve it, and the last thing we want to do is reduce fat in the mid face. And so for that, we really want to work just at a superficial level at 1 to 2 millimeters on the skin. So as a patient, you need to know, am I right for you? And a good assessment will tell you, but pretty much everyone is going to be suitable. There are a couple of contraindications, which of course people should be aware of. If you've got pacemakers, certain caution, etc. But otherwise, most people can have this treatment. Secondly, people are worried about discomfort because there's pins involved, right? There's energy involved. Well, actually, I would say most of our patients have a perfectly tolerable experience, evidenced by the fact that they come back for their next session and the next one and maintenance sessions thereafter, which I will go into. So really, with a good numbing cream and a good protocol, you can really have a treatment that's tolerable. I'm not going to say it's pain-free, although some patients do actually say they feel nothing. I've had it a couple of times. You can see my Instagram live, Dr. Dev Patel 1, where I've had a couple of treatments live, and I've been talking through the videos. But of course, if someone is feeling undue discomfort, there are other things some clinics can provide, like nerve blocks, etc., etc. But people don't tend to need it with this, which is what I like. What are you going to look like after the treatment? Well, it's going to take, for the face and neck, maybe around 30, 40 minutes to have a treatment, depending on how many shots you have, how many passes. And then you're going to look like you've had a little bit of mild sunburn, and you will feel quite hot. Now, at this clinic, we always apply Solderma GF5 bioregenerative serum before and after treatment. So we've actually got some quite big retrospective studies to back up that people heal quicker and they actually have better, more satisfactory outcomes after Morpheus8 in combination with that. So really, we would use that straight away. It brings the heat down, calms down, and starts hydrating and repairing the barrier. Typically, people, it does vary, but you could be red for a day, 2. Some people can have a few marks left even at a week, but typically up to a week, expect some skin changes to be visible. Then even in some cases, the week after and week after, there might be 1 or 2 areas where you can just see where the pins have been in, but it's nothing that makeup can't cover up. The other thing to be aware of is that it's a gradual, slow process. What are we doing from these changes in the skin? We're triggering your body to go into a rebuilding or remodeling cycle. So that takes time, like building a house takes time. So I wouldn't set your expectations too high too soon. Sometimes the initial swelling can really excite people, and that's just a bit of swelling. So really, typically, if you're using the GF5 in combination, then yes, you are going to probably appreciate improvements in your skin quality very quickly. But otherwise, I wouldn't expect you to really appreciate fantastic results for maybe 2, 3, 4 months. And I always say to patients, actually, wait until the 4 to 6 month point before you think, well, did this really do anything? But most people will start seeing things sooner. And of course, from our early studies we did with Fractura, which is very similar to Morpheus8, a predecessor, but we still use that for scarring, we actually found that at 15 months, we were seeing a peak in skin quality and improvement. So it is actually a long process to get the maximal results. Remember though, if you go through significant illness, significant stress, or you are perimenopausal, the acceleration of aging that your skin and body is going through could outmatch the improvements that you're getting from this or any other treatment. And therefore your perception may not be to the degree that you were hoping for. But this is something that a really good practitioner should be discussing with you in the pre-treatment consultation, so you're fully aware and informed of all the factors that you need to consider to ensure that not only do you get good results, but that your perception is positive and that you actually feel that the investment in your skin was worth going through that journey. For me, if you do 3 sessions, that's typically a really good number, about 6 weeks apart. I feel, although people heal much earlier, if we do it too soon, they are more sensitive on the second session. So we keep it at least 6 weeks apart, maybe even 8. So it will take a few months, 3 to 4 months to finish your course of 3. And then after that, really, it depends on where you are. If you're happy and you see your final results come through, then really doing 1 session every year as a maintenance, I think is a really good thing to stick to, because you're doing the whole of your canvas, the whole face and neck in one go. You don't have to faff with lots of different treatments. And that's taking care of your skin tightening and your collagen needs and putting collagen back into the bank. So what areas can you treat? Well, a lot actually. You can treat the face, the neck, you can treat the abdominal area, the buttocks, the outer thighs, the inner thighs, over the knees. The arms is a very common area that people seek. So most areas actually you can treat for skin tightening and even fat reduction. The tip that I was showing you is typically used for the face. We do have a body tip, and this is the body handpiece. This actually has the burst mode, which sounds explosive, but actually what it does is it gives you the ability to introduce the pins once, but actually fire off at different levels. So it will fire off at, say, 7 millimeters, and then the pins will come up to 5 millimeter depth, fire again, then up to 3, fire again, and then come out. So you've got a triple layered hit of energy and activity from one single pin entry, which is nicer for the patient. And of course, it means you can get a lot more done and a multi-layered approach, which gives you fantastic results. We've done that. I've actually used that mode on the neck in combination with other treatments, and it gives a phenomenal result and can even sometimes give a result that isn't far off a mini surgical procedure. Not saying that that's typically what we'd tell people to expect. So that can give you quite powerful results. So I think the most common areas other than the face and neck that people would get done are the backs of arms and also the crepey skin on the arms. The abdomen, of course, particularly, if someone's post-pregnancy and they've got the skin laxity or they've lost a lot of weight. A lot of people on GLP-1 medication have definitely been seeing significant age-related changes in terms of loss of elasticity and volume on the face, the neck, and indeed the body. So this technology can really help those patients as well. And of course, the typical areas, particularly for ladies, the buttocks, just at the bottom of the buttocks, the outer and inner thighs is another common area. So yeah, if you are interested in any of those areas, just discuss them with your practitioner and then they can advise you better. And then what you probably do need to consider a little bit more is, okay, what's my topical home therapy going to be? Yes, I'm obviously going to talk about Saldana, but that's really important. Or something that's really going to do a lot of good for your skin: retinoids, vitamin A's, vitamin C, sunscreen, of course, and maybe drop in things like growth factors. And then what else are you going to do? So deal with maybe discoloration, the reds, the browns, all those issues, which something like the Lamecca system, also from InMode, can be brilliant for. But that's another video. So if you've got any questions or any other comments, do drop them below, and I hope you enjoyed this video.